it's CJ. Did you know that if you have an ultrasound in the first trimester of your pregnancy, it can provide a lot of really beneficial information for not just you, but for the baby as well? Today we're going to talk about the best time to schedule your first ultrasound, what you can expect when you go in for that scan, including exactly what the ultrasonographer is looking for. And if you stick around, I will also let you know what you can expect if your baby's measurements do not line up with your last menstrual cycle dates. The first ultrasound is usually done sometime between 7 and 14 weeks. Now, if you have a history of irregular menstrual cycles, you have an unknown last menstrual cycle, you got pregnant while you were breastfeeding, or you were on birth control, if you are having bleeding in the first trimester, if you have a long-term health issue such as diabetes, high blood pressure, epilepsy, if you have a history of recurrent pregnant loss, your provider might want to see you before 7 weeks for that first scan. When you come in for that first ultrasound, sometimes they want you to have a full bladder and sometimes they don't. Usually the ultrasound is done transabdominally over the top of your abdomen. That being said, if you are too early or if your uterus is retroverted, tipped back, they may do the ultrasound transvaginally with a wand that goes inside of your vagina. The ultrasonographer is going to be looking for 5 different things. Number 1, where is the pregnancy located? Is it in your uterus where it belongs? They will most likely also want to take a look at both of your ovaries. Number 2, exactly how many babies do you have in your uterus? Number 3, is there a detectable heartbeat? And if so, is the heart rate within normal limits? Number 4, depending on how far along you are, they may measure the baby's neck as part of a genetic screening test. And number 5, this is the most important thing, they're going to measure the baby 3 times from the top of the head to the bottom of the booty. That is called a crown rump length. They're going to take those 3 measurements and average them together to see exactly how far along you are. If your baby's measurements match the last menstrual cycle dates, they will use that for your due date. If you are less than 9 weeks pregnant and there is more than a 5-day discrepancy, the baby is 6 days bigger or 6 days smaller than he or she should be, they will probably change your due date to that of the ultrasound dating. If you are between 9 and 14 weeks and there is more than a 7-day discrepancy, the baby's 8 days bigger or 8 days smaller than he or she should be, again, they will most likely change the due date to that of the ultrasound dating. Unfortunately, if you do not have your first ultrasound until after 22 weeks, that is considered suboptimal because the dating scans just aren't nearly as accurate once you get past 22 weeks, which can cause problems if you go into preterm labor later in your pregnancy. That is why I highly recommend you start your prenatal care as soon as you get that positive pregnancy test. So what questions do you have regarding that first ultrasound? I hope you'll leave that in the comment section below. If you are an ultrasonographer or a radiologist and you have anything you'd like to say, please feel free to chime in. I'm a nurse practitioner. I am not an ultrasonographer, and I so value your input. And while y'all are down there, if you want to hit the like button or even share this video, I would certainly appreciate that as well. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.